And this is where we have mothers who are experiencing the postpartum psychosis. When we talk about postpartum psychosis, these mothers, they are experiencing hallucinations. They are seeing things that other people cannot see. They are hearing voices that sometimes they are commanding them, maybe to injure the baby. Maybe they are commanding them and telling them the baby maybe it's no longer a baby, maybe it is a snake. And sometimes they want to kill the snake. So most of the time that you see this mother killing their infants, it's not they are seeing the infant, they are seeing another thing.
Something else.
They are, something else. So you find them that they kill the baby and sometimes they commit suicide. They feel unworthy. They feel the voices commanding them to kill themselves. They see people who other people cannot see. That's a form of psychosis. And we say it is sometimes the setting is acute. It occurs within from 48 hours and it can run up to months and sometimes up to 6 weeks or beyond. This form of psychosis, and if it is not well managed, the mother can develop full psychosis after that.
Full psychosis meaning?
Full psychosis means that this mother, I don't want to say that she'll become mad, but actually
she might.
She might, if not well managed.
Yes. Postpartum depression, what is this word? It is a word that most people may not understand because they have not experienced it. They do not know anyone who has gone through it, but it is a word that is affecting everyone in the society. Why? If a mother is going through postpartum depression, definitely it's gonna affect the children, it's gonna affect the husband, it's gonna affect the people who are working with that person, but we do not know how to handle these people. Do you know what is postpartum depression? You're just about to know it. Welcome to Divinely Inspired Media. My name is Sylvia and this is the moment for you to learn. Yes, let me start by welcoming you. Welcome to our show.
Thank you.
Yeah, you can perhaps introduce yourself and then we go straight to knowing what is postpartum depression.
Thank you, Sylvia.
Yes.
My name is Bedwajiko Muirori and professionally I'm a nurse. About postpartum depression, we can say that we have the classification of this. We have the postpartum depression, we have the postpartum psychosis, and we have the motherhood blues. We can start with motherhood blues. It says that the mother experienced a kind of fear of unknown about the baby, about the life of the baby, and about her life after the delivery. Motherhood blues are most experienced by the first-time mothers, the primigravida, or those mothers who have never given birth. And most of the problem, most of the fears is about they might lose their baby. So you might fight them. Most of the time they are crying. They are always near the baby. They don't want to leave the baby. They don't want to go away from the baby because some of them fear that the baby might die. We have the other one that is postpartum psychosis. Postpartum psychosis, it's a severe form of psychosis that mothers in puerperium experience. And maybe by first defining what is puerperium. Puerperium is the period that that follow a delivery, from delivery up to 6 weeks, and this is where we have mothers who are experiencing the postpartum psychosis. When we talk about postpartum psychosis, these mothers, they are experiencing hallucinations. They are seeing things that other people cannot see. They are hearing voices that sometimes they are commanding them, maybe to injure the baby. Maybe they are commanding them and telling them the baby maybe it's no longer a baby, maybe it is a snake. And sometimes they want to kill the snake. So most of the time that you see this mother killing their infants, it's not they are seeing the infant, they are seeing another thing.
Something else.
They are, something else. So you find them that they kill the baby and sometimes they commit suicide. They feel unworthy. They feel the voices commanding them to kill themselves. They see people who other people cannot see. That's a form of psychosis. And we say it is sometimes the setting is acute. It occurs within from 48 hours and it can run up to months and sometimes up to 6 weeks or beyond. This form of psychosis, and if it is not well managed, the mother can develop full psychosis after that. Full psychosis meaning? Full psychosis means that this mother, I don't want to say that she'll become mad, but actually she might if not well managed. Yes. And that's why we say that when you see these mothers with puerperal psychosis before I go to depression, this should be well managed. They should be taken to the hospital. They should be put on treatment because this form of psychosis, it is a severe one. It is a severe one, and most of the time they don't want to be associated with the baby. They are supposed to be put on treatment. Actually, this form of psychosis, that puerperal psychosis, most of the time they are admitted in the hospitals in the acute phase, and they're separated from the baby because the problem it is the baby. The problem is the baby. The problem is the baby. They don't want to see the baby. Yes. They don't want to be associated with the baby. Yes. But maybe after the treatment, then they recover, they are put on treatment, they accept the baby. Most of the time, they are given, the parents, the guardian are given the baby to go with the baby home. And sometimes if it occurs within the hospital premises, the baby is taken to nursery to be nursed there until the acute phase is over. During this time, this mother needs a lot of support from the medical team, from the family team, and especially if it occurs after the discharge, after the delivery, maybe 2 to 3 days. When they go home and nobody is understanding them, they are seeing the baby, they are seeing the baby as a demon, they are seeing the baby as a snake. They are seeing a baby, maybe the baby have horns. And they want to save their baby, so they want to remove the horns from the baby. So eventually they kill the baby. So the family members, when they see these mothers, they really need to support them, to understand them, and to really think what is happening with this mother. Because when we look at some of the risk factors of the postpartum psychosis, it is lack of some family support during pregnancy and isolation. Yes. Maybe this mother was experiencing pregnancy come with many people experience different things during pregnancy. Some of them, they may feel they are not happy about the pregnancy. Maybe it was not their timing. Others, maybe there are so many complications that occur within the pregnancy. Some of them, they are not feeding meat. Some of them, they don't want to take food with onions. And during that time, if this mother is not supported by the family and the mother is isolated, eventually may develop the postpartum psychosis. And therefore, during this time after the delivery, the mother needs a lot of support from the family. They need to understand her, because if this isolation continues, most of the mother go to postpartum psychosis or depression. And they feel unworthy, they feel they are not worthy, they feel that they hate themselves. But now basically talking about the postpartum psychosis, I've said some of the risk factors, it is lack of some family support. Another one, it is family history. Maybe in the family that this mother is coming from, they have a history of psychosis, mental illness. If the pregnancy was not handled well, the mother may develop the depression, postpartum depression, or postpartum psychosis. And therefore, when we have mothers who are coming from family with history of mental illness, they're supposed to be followed up well. They're supposed to be supported
when they are pregnant.
And even after delivery. Another risk factor of the postpartum psychosis it is the first-time mothers.
Okay.
The first-time mothers, and especially the elderly ones, they have fear of unknown. One, they were expecting this baby. Maybe to say, we can say that when we say elderly prime gravida, the first-time mothers who have maybe after 25 years, after 27 years, most of those mothers, they are ready to give birth, and they're expecting.
They are waiting. They are happy about it.
So when they carry this pregnancy, immediately after the birth, they want to keep their baby. They don't want to have their baby. Some friends of people sharing how they lost their baby into care. They have the fear of unknown.
Yeah.
And eventually of a protecting their babies, they might develop the psychosis, the depression. So the first-time mothers, and especially the elderly ones, they need to be supported still during the pregnancy
and
even after. We have some causes of this condition.
Yes.
And sometimes we talk about genetic factors. And sometimes you hear when we say, when you talk about other condition like diabetes, we say genetic, it runs in the family. The same case with this condition that we are calling
PPD.
It's run in the family unless there is an intervention.
Yes.
So genetic factors, if there was a member of the family who was experiencing mental illness, the mother might experience the same.
Yes.
And that's what I've said previously, that we need to take care of these mothers, especially where there is that family history. The other one is hormones. During pregnancy, there are two hormones that really working to ensure that the pregnancy is carried to term. We have two hormones that we call estrogen and progesterone.
Yeah.
And they ensure the pregnancy from conception to the delivery. They ensure the baby is safe and the pregnancy is carried to the term.
Yes.
And immediately after the birth of the baby, these two hormones, they go down. So the hormonal imbalance from having very high progesterone and estrogen, immediately the baby is delivered, the hormones go down.
Yeah.
So that hormonal imbalance, in some women, they experience they develop the psychosis.
Yeah.
And therefore, we also need to understand this mother. So when this mother comes at home, and maybe it is the first baby, maybe it is the second one, we need to support them when we see signs that are not normal, the abnormal signs.
Yeah.
Another sign is something we call neurotransmitters. Neurotransmitters, in simple, they are kind of nerve cells. They are messages from the brain, and they coordinate.
Yes.
And these neurotransmitters, there are some that we have that are involved in happiness, in behaviors. In case these two, I don't want to go so deep into that.
Yes, yes.
This, when there is unbalance of these two hormones that are involved in mood, stabilizing mood and behaviors,
yes,
of course, the mother might develop psychosis. So we need to support these mothers when they are discharged from the hospital after the delivery, from 48 hours up to 6 weeks and beyond. When we observe an abnormal behavior in the mother, don't judge them.
Yes.
Try to support them, try to know what is happening to them. And then from there, once you support them, if it is severe, then you can seek medical attention.
Okay, you know the reason I came up with this topic is because I came to realize most of the people who have gone through it do not know they are going through it.
Yeah.
And probably when people are narrating their situations, or maybe you come along a show like this one to hear what is postpartum depression, that is now when you have the flashbacks and not, oh, I was doing that, or I went through this, but I didn't know it's postpartum depression. And worse is the people that you're living with do not know either. So most of the times you'll find maybe people who are saying, you have changed since you got a baby, you have become different, and especially men do not know anything about postpartum depression. Yeah, not all of them, but most of them do not understand postpartum depression. Yeah, I was talking to a certain gentleman, and he was surprised that things happen after having a baby. He actually told me, every right for me, I go search this. Yeah, you know, I don't know, probably the wife has had a baby or something, but he was mesmerized. He was really shocked that there is such a word or such a thing that happens to women when they give birth. So if men understood such, they would handle their wives differently. If the people now that we are living in our houses with would understand that, definitely the environment would be better. And I want to ask about the baby blues, because that one you have tackled it shallowly. Let's talk about the baby blues. What is a baby blues, or what are the experiences in the baby blues, and how long does it last probably for most people?
Baby blues, we can say it is there. We have mothers who have given birth, and they have fear of unknown. And some of the experiences, I've seen mothers who come to the hospital, they are crying that the baby is confessing. But once we stay with the baby in the hospital and observe the baby, when the baby maybe lays their hearts, the mother thinks that the baby is confessing. So motherhood blues, it's like the mother having fear of unknown about the safety of the baby. Actually, it is about the safety of the baby. They are fearing that they might lose the baby. They are fearing that the baby might die. When the baby is just racing the heart, they fear that the baby is confessing. And we have seen them in the hospital seeking medical attention. Sometimes, you see, sometimes the baby fails to sleep at night, and they sleep during the day. So the mother feels that if my baby is not sleeping during the night, this baby might be having a problem. And you see those mothers coming back. So we call them motherhood blues, because these are a very new mother, maybe within 40, she has given birth, maybe within 48 hours, the mother is not certain, the mother is fearing that the baby might die. We call, those are mild ones, and we call them motherhood blues. The best thing about this one, you talk to the mother, you counsel the mother, you support the mother. The mother now settle down that my baby is okay. Apart, the baby is okay. Other than the PPB, the mother already is having psychotic signs. Does it get to a level whereby people are using medicine? Of course, a mother with postpartum psychosis, they are put on treatment. They are put on antidepressants. They are put on mood stabilizers, and then they are referred for psychotherapy. Because when a mother or any patient experience hallucinations and delusion, this person is a risk to his life, and even the risk of those people who are around him. Because hallucination, as I had said earlier on, this person or the mother is hearing voices instructing her to do something. Yet the other people, they cannot see, they cannot hear, they cannot see. They are also seeing other people or other things instructing her, or things that maybe the mother can look at this tree and say, this tree have turned to a lion. What happened when you see a lion? You either run away or you try to kill it. But actually, in actual fact, you are killing somebody.
Oh my goodness.
So they are risk to themselves, and we say that those people, they are not supposed to stay with people unless they are put on treatment and they are able to control the hallucinations and delusions.
Wow. Then we have these situations whereby after giving birth, most people add weight, serious weight, you know. Someone can move from 50 kgs to 130, you know. And when you're coming home from the hospital, you're a totally different person. Definitely this affects the mother as well, who is now looking different. Probably she's not even liking how she looks. Most ladies don't want to add so much weight, you know. She doesn't feel comfortable, confident, but she doesn't even have someone who is acknowledging that she just gave birth. And most of the times you'll hear people telling maybe women who've just given birth, umeongeza kilo, you need to stop eating. You know, umenona sana, especially me, that word, it really annoys me. Yeah. Yes, it's distasteful, you know. It is bad to tell people that. And worse is, I had a friend of mine who told me that she was not body shamed by outsiders, but by the husband after having a baby, you know, because she added too much weight. Does that also contribute to women experiencing that depression after having a baby?
It is true. It's unfortunate that traditionally, people believe that once you give birth, you're supposed to eat.
Yes.
Take a lot of porridge, take a lot of tea. But basically, even after giving birth, you don't need all that food. You need just enough meal and enough drinks to ensure that you have enough.
You have enough milk. Yeah.
Adding weight, it's because of eating. Actually, like me, after my second born, I added almost 30 kgs, and it was not a good experience to me. Yeah. And also, of course, people are telling me, "Hey, umeongeza kilo."
Yeah.
Hata kutembea huwezi.
Imagine
you're not even able to walk.
Yeah.
Actually, the mothers who add weight during period, most of the people. Of course, when they tell them that, hey, you have added weight, hey, you look bad, and especially the family members, it leads to depression.
Yeah.
And you know, shedding weight during period, it's not easy.
It's not easy.
Because you need to feed, not as
to
much.
Feed someone.
And to feed someone.
Yes.
Because once you go to the facility to maybe for clinic, the doctor will ask you, what is happening? You are not eating, the baby is not adding weight. But what we are saying currently, you don't need to eat a lot of food, and especially carbohydrates. You need to eat enough fruit, you need to take enough vegetables, proteins, and a bit of carbohydrates, and to take a lot of fruits, and not necessarily soup, porridge, a lot of tea, milk. No, you just need to take enough. Because even shedding that weight during period, it is not easy.
Yes.
Actually, most of the people, they are able to shed weight after they are stopped
breastfeeding.
We need to support these mothers even as they add weight. And also we need to note that during pregnancy, the mother add up to 12 kgs. In a normal pregnancy, the mother is supposed to add 12 kgs, and of which the mother may give birth to a baby weighing 3 kgs.
Yes.
But you see there are other 9 kgs.
Yes, 9 kgs.
So we need to support the mothers. They add weight during pregnancy and even during period. Once they add weight, we need to support them, maybe advise them how they should take their meals, and also support them that they are adding weight because they are supporting another baby.
Yes.
Because it causes that body shaming, those words, those nasty words,
they're bad,
that comes across them.
Yes.
They register them in their mind.
Yes.
And eventually this mother might go into
depression.
Psychosis. Ama period depression. Yeah.
Wow, that is so amazing. You know, I have so much to ask about postpartum depression, because we need to support these people. We need to be there for the woman who is creating, you know, because giving birth is not an easy task. It also needs, people come with expectations, because you've been expectations of people handling you differently, because now you have moved from one stage to the next one. Yes. One amazing thing about this discussion is that Beth is a professional in this, and she's also a mother. That is why we felt that it is important for a mother to tell us what is experienced out there, and for men to understand how to handle their women. These are the topics that we handle here because mental health is our responsibility. Mental health issues, it is our responsibility to know them and understand them and know how to handle and respect each other out there. Thank you so much for tuning in to Divinely Inspired Media. This is us, and keep watching. Bye bye.